Welcome back to Just the Facts, the weekly vidcast from factcheck.org. I'm Emmy Kalawale here with your weekly dose of fact versus fiction. This week we take a look at two very important topics in the lead up to the Democratic nomination, NAFTA and healthcare. Both Senators Hillary Clinton and Barack Obama were crying foul in this last debate, but let's take a look. NAFTA was the subject of a very nasty mailer back and forth between the two candidates. But first, we take a look at Senator Hillary Clinton.
I have been a critic of NAFTA from the very beginning. I didn't have a public position on it because I was part of the administration. But when I started running for the Senate, I have been a critic. I've said it was flawed.
We find Clinton's position on NAFTA to be more ambivalent than concrete. She's accurate to say she was a critic of NAFTA during her years in the White House, at least according to her biographers. But she publicly supported the measure as First Lady, and she didn't criticize NAFTA until after she left the White House. But Barack Obama went a step too far when he attempted to paint Clinton as a cheerleader for NAFTA as recently as 4 years ago. Let's listen.
I think that it is inaccurate for Senator Clinton to say that she's always opposed NAFTA. In her campaign for Senate, she said that NAFTA, on balance, had been good for New York and good for America.
She did say that, and many economists agree too. But what Obama failed to mention is that she also said in the same breath that our past trade deals need a revamp. I think we need a rethinking of our trade policies. Tougher terms, more enforcement. That's been her line for years. But the fact is, Clinton and Obama have very similar stands. They both say they will get out of NAFTA unless Mexico and Canada agree to renegotiate. But let's move on to healthcare. Both candidates claim their plan will cut costs more. Don't believe us? Check it out.
We do more to reduce costs than any other plan that's been out there.
I have the most aggressive measures to reduce costs and improve quality, and time again, people who have compared our two approaches have concluded that.
It is just not accurate to say that Senator Clinton does more to control costs than mine. That is not the case. There are many experts who've concluded that she does not.
What's true is that they both clearly can't be right, and we find that the evidence supports neither candidate. According to MIT professor Jonathan Gruber, there's very little evidence to suggest that either would make a major dent in healthcare costs, and certainly no evidence as to one person's plan being better than another's. And that comes from an expert who likes both plans. Another expert, John Shields, told us, "I don't think anyone seriously expects that they would start generating those savings." And Kenneth Thorpe of Emory University chimed in that both plans were virtually identical when it comes to overall cost reduction. So next time you hear the candidates claim their plan will cut costs more than the other, just ask yourself, who says? And that's it for this week on Just the Facts, the last week of February. For more details on these and other stories, be sure to check out our website at www.factcheck.org. I'm Emmy Kalawale. Thanks for watching, and see you next week.